Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about palpating the abdomen. Okay, so here's the gist of this. I think it should be a part of our rehab, wellness evaluations for our otherwise, not coming in necessarily for a post-op cruciate, but, if you got a dog that looks like it's sore in the tummy, or it doesn't really fit your typical, oh, this dog is just, whatever, your typical IVDD or lumbosacral or post-op cruciate. I think we all, and so not just the vets, but I'm speaking then to the physiotherapists and as well as the veterinary technicians to palpate the abdomen. Few things. Start doing this because I think it's good to know the normals so that you can pick up if something is abnormal. And by abnormal, really the biggest takeaway I would want you to do with this is to identify if there's pain. So I'm not diagnosing, the physiotherapists are not diagnosing the what's going on, or and the vet techs aren't diagnosing what's going on, but really we should be able to identify there is pain in the left upper quadrant of the abdomen, because if we are working as a veterinary team, we should be part of those who are screening this animal on a regular basis to make sure that the health status overall is good. Okay, and also then, clearly to refer back to the referring DVM to identify or do further testing of what's going on. So again, know your quadrant, or test your quadrants, okay? But then know what organs are there and what you might be touching. And to this, get a good anatomy textbook or 5, right? So I've got 5 here. So because I like to collect. So here's one, but it's very pictorial, but that's all right. I like ones where I can look at and go, alrighty, so, okay, here's my kidneys, and they are in relation to psoas major. I like ones where I can kind of figure out my spacing between things. So you've got that guy. I've got, the Bible, but I'm going to say it is a little bit limited as far as the all the pictures go, but it's still good, right? This one always blew me away. This is your large intestine, right? And you've got your, where are we here? We've got our cecum and our ascending colon, our transverse colon, our descending colon. That looks different than what yours and mine do. So especially for the physiotherapist, I would say, it's not going to be the same. If you have done a course in visceral manipulation, the anatomy is a little bit different because gravity isn't pulling the dog's belly caudally, right? So that looks different. This one, okay, had some nice pictures. I know, ooh, it's gross, ooh, it's real pictures of a real gross insides. Yeah. But like this is fantastic too, because you've got, well, here's all of my intestines. Here is my, one I think's got to be our liver. One is liver. Whoa, that guy's our spleen. Knowing which side the organs are on is important, right? I would say that's what taking the visceral manipulation course did for me, is where I'm like, I can, well, even, I guess, yeah, I did this in dissection too, but if I close my eyes, I can see that, here is my liver, here's my stomach, my spleen is over here, pancreas is in the middle, and which way my colon goes up, over, and down. Okay, very important. Actually, I like the pictures in that one. Okay, you've also got your quintessential, I always called this the dead dog book, but anyways, they're a little grotty, they're not colorful, but it does help give you, what I like is it kind of bridges the gap and takes a layer and then a layer and then a layer. So you can kind of have that one. And then this one is also one of the better ones for looking at this. Clearly the dissection of the dog. Okay, and I like the ones where it shows the organs in relation to where the rib cage is, where the pelvis is, so I can kind of see where does the liver sit, where does the spleen sit. Okay, I can see all of these in relation to the spinal column, but the rib cage, right? The axial skeleton. So I think these are good then, so that as you are palpating around inside the dog's abdomen, you have some idea where you are. Now, you don't have to necessarily go back to the referring vet. I mean, I'm not, and say the spleen is tender, but I can say that there is tenderness in the upper left-hand quadrant, and go from there. Okay, so anyways, that is just my tidbit of encouragement to learn the visceral anatomy so that you can put your hands on it, so that we can be part of the larger veterinary teams, and that it's important that we all accept some degree of responsibility for not allowing patients to fall through the cracks by being so siloed, which is a problem in vet medicine, a problem in human medicine, where, I mean, you look at more from our specialist standpoint, right? Everybody is so siloed that you don't look at everything. So to help with that, one of the things that, at least from in our rehab practices, that we can do, nodding our head to the fact that, we are not full practicing if we're just rehab, is to at least palpate the abdomen so that we can convey that information back to the referring DVMs for further testing. That is it. 7 minutes. Until next time, cheers.